Federal cuts are being felt across Metro Atlanta, with thousands of workers receiving layoff notices this week. As part of the Trump administration's plan to restructure the Department of Health and Human Services.
That's right, but some of those who are doing critical research worry that these cuts may not only be costly, but deadly. 11 Alive's Molly Oak has this story.
These are human tragedies that are occurring, but we're also losing the expertise. We're also losing the workforce.
Dr. Carlos Del Rio is the chair of the Department of Medicine at Emory University School of Medicine.
I'm old enough to have seen HIV when it emerged and how, it was people essentially dying and not having, not having any hope. And I've seen how research has really transformed HIV.
He's worried the cuts will not only put things on pause.
We're going to go back in time. We're going to go back to HIV the way it was before. New infections will continue to rise again, and transmission will occur, deaths will go up.
He says the cuts, which are intended to save money, will ultimately cost more, and not just financially.
These cuts are deadly, these cuts are inhumane, and these cuts will be impacting people. And unfortunately, some of the people impacted are the most vulnerable population.
Molly Oak, 11 Alive News.
11 Alive also checked in with the Georgia Department of Public Health. It confirmed 180 staff members were laid off, most of which were COVID-specific contact tracers. DPS also told us that certain federal COVID funding sources were terminated, which added up to more than $330 million.